would expect a Senate Budget Committee hearing to be pretty dry stuff. However, today, witnesses on both sides of the abortion issue testified in a vigorous and at times emotional way.
Senator Guzzoni has a panel.
Should lawmakers greenlight $2 million in startup costs to establish a public health abortion grant program? Supporters of Senate Bill 848 said yes, and here's why. At a Senate hearing on the bill today, abortion care is constitutional, codified in state law, they said, and this bill expands equitable access to un- and underinsured women. It's also a financial no-brainer, witnesses told the panel, since the money comes from a pot of insurance premiums carriers have been collecting for a decade. It wouldn't cost Maryland taxpayers a dime, according to State Comptroller, Democrat Brooke Lierman.
This bill will use money, $25 million, $3 million a year it's accruing at a rate of, that is not taxpayer dollars, to make sure that we can provide that abortion care access to American women.
Lierman's testimony added fiscal and political clout to the push for passage of the bill that supporters also call groundbreaking. It's a first-in-the-nation program, they say, and it's in direct opposition to efforts by the White House and congressional Republicans to restrict abortion access.
It's up to states that have embraced and believe in providing abortion care access and the full range of reproductive health care access to women. It's up to us to step up and make sure that American women, no matter where they live, have options.
Opponents testified too. Some called the bill discriminatory, and insurance companies apparently balked, claiming it's their money to spend, not the state's.
So we're opposed to that for moral reasons, obviously, but we also think that this is just a bad financial decision for Maryland, especially when we're already at a $3 billion deficit.
The executive director of Maryland Right to Life said it's money that should never have been collected in the first place.
They forced insurance companies to fully fund abortion. This is elective abortion, not necessarily medically necessarily or for rape, incest, life of the mother, but elective abortion, fully fund without co-pays and deductibles.
Lawmakers have seen different versions of this bill before. It didn't get out of committee in 2024. This year's version is pared down and more narrowly focused, and if passed, it would take effect July 1st. Reporting live from Annapolis tonight, I'm Kate Amara, WBAL, TV 11 News.